G'day, welcome to lesson 2, which is the number one way to fix your back pain. So today I'm going to show you my number one exercise for you over the next 6 weeks to start to fix your back pain. So this is where we're going to begin. This is where the rubber really hits the road. So we're going to talk about why this is the best exercise to help your back pain. We're going to talk about, and I'll show you what this exercise involves, and I'm going to show you how to do it properly. I'll tell you how many of them to do and how often to do. And I want to also talk to you about the main mistakes that people make when they do this exercise. So why is this the number one exercise to fix back pain? So in lesson 1 we spoke about the sacroiliac joint, which is where the spine meets the pelvis, and this is an exercise for the glutes, which are the muscle that attaches to the pelvis and helps to stabilise the sacroiliac joint. So in my 13 years of being a physiotherapist, I've found that most people with lower back pain, this glute muscle doesn't work really well in the body. This is a very simple, pain-free way to get these muscles working and to hold the pelvis together and give good stability so you can get some relief, start to get a good sleep and just be able to move a little bit more comfortably. Okay, so what the exercise involves is it's an exercise we do standing up, where I need you to find something that you're going to hold onto, and it could be your kitchen bench, it could be your bathroom sink. It's just somewhere where you feel comfortable and stable. Okay, so what we're going to do now is I'm going to show you how to do the exercise, and I'll give you a couple of angles too. Okay, so we want to find a surface where you can hold on. So I'm going to use this rail over here. So I'm going to show you from a few different angles. So I'm standing up nice and tall, holding onto the rail, and I'm going to kick my left leg out and a little bit backwards. Now I'll show you this from a couple of different angles, just so it can make it easier for you. So I kick my leg out and a little bit back. It's important to do the little bit back. Nice and slowly, and I'm trying not to move with my spine. From the front, this is what it looks like. So I'm just going to hold on with this hand. So I kick my leg out and it goes backwards a little bit. Nice, slow speed. Notice I'm not moving my body and the movement's very smooth. So this exercise works the side glute or the gluteus medius. So what I want you to do is to practice this exercise here now, and I want you to do 20 of them on each side. Okay, so 20 on the left side first, 20 on the right. So the next thing I'm going to do is I'm going to explain to you the mistakes that people make when they do it, as I demonstrate the exercise to you again, just to make sure you can do it properly. Okay, so a lot of people when they do this exercise, they kick their leg directly to the side and even a little bit forwards. Now if you do that, you're working the wrong muscle. You're working the muscles at the front of the hip, not the buttock. So you've got to make sure the angle's back, just like this. Sometimes even putting your hand on the muscle helps. Now again, many people rush the exercise, so they do it too quick. If you do it too quick, it doesn't give enough muscle fibers an opportunity for them to activate. So you've got to do it a little bit slowly. And you can rest your foot just very briefly for a millisecond every time you come back. And the other thing people do wrong is they do this. So I'll show you from front on. As they kick their leg out, they move their body. So I don't want you to do it like that either. So yeah, I'll just go through it once here for you. So everything perfect. So my leg comes out and back, upper body not moving, nice and slow, tiny little rest every time. Okay, so what I want you to do as part of your plan, so let's do this exercise morning and night. I don't mind whether you do it, say, at your kitchen bench or your bathroom sink when you're brushing your teeth. We've got to do it at one of those times where you've got a little bit of downtime, because I know you have a busy life. So what I'd like you to do is do 20 on the left and 20 on the right, morning and night. So that's going to be the simple plan that we start with. If you have an opportunity to do it more, it's only going to help you. So if you wanted to do an extra time through the day, I'd recommend people to do it anywhere from twice at the minimum to 5 times a day at the maximum. If you do it the way I've described, then you're not going to hurt yourself and you're going to get the most out of it in terms of effectiveness. Yeah, so to summarise today, the number one exercise to fix your back pain is what I call a glute side kick. It fixes the back pain best because it stabilises the pelvis, which immediately will help you with your sacroiliac joint pain, and it'll give some support on which your back can move and bend. So you do it properly by holding onto a surface, kicking your leg out a little bit back, slight rest every time, quite slowly, and not leaning to the other side with your back. How many of them we're going to do? We're going to do at least twice a day, morning and night, 20. That's your target. If you want to do it any more, you can, up to about 5 times a day. Okay?